The Institute for Urban Indigenous Health was established back in 2009 in response to some fairly big challenges that were confronting our health services and communities in southeast Queensland. So huge population growth, one of the fastest growing regions in the country, and also really a neglect from government at the time, the importance of actually closing the gap in urban environments. The belief that the gap only resided in remote communities, that we didn't have a gap in a region which was responsible for over a third of the state's Indigenous population. Over 5 years, by working the way we have and with really good governance, we've seen a huge increase in the number of health services operating, community controlled health services operating in the region, so from 5 clinics in 2009 to 15 now. And with that increase in clinics, improving access to health care, we've tripled the number of Aboriginal people and Islander people accessing our services. We've also improved and turned around the whole understanding about health in southeast Queensland, the importance of focusing on prevention, not just managing disease.
So what are you going to try to do, Arnie? We're going to hold our hands a little bit higher?
Work it out here for the first instance. It's obviously around our chronic disease patients and they're referred across to the Work It Out program, and that's obviously around education, around healthy living, and a big part of that is obviously the physical activity where these guys are medically assisted, professionally assisted by our people in the gym. And the benefits of that are amazing, and it just sort of goes hand in hand also with the Deadly Choices program, which is obviously a community-based program as well that promotes healthy living to our mob, but also there's a big incentive around that to get our mob to come and get health checks, and that's been the big ringer for us, and it's achieving some great goals there as well.
So from mums and bubs, ensuring that mums have access to good mums and bubs services and are encouraged to access care as early as they can, to having programs into schools, educating kids about the importance of never smoking and making smart choices, deadly choices about their lifestyle, all the way through to aged care services now. So we're delivering community aged care services across the far north of Brisbane.
Country music, countrywide. 98.9 FM for the best country.
Well, today on the program we have Mick Dodson.
Well, with the station here, 98.9 FM, I think it has played a big role in the promotions and the success of IUIH, but they'd get the success without us anyway. I mean, they're so innovative and focus on community.
It's made such a difference to my life, to my health, but to my mental attitude, to how I function. I feel there's a great big new world out there and it's waiting for me to discover it.
One of the things I think about the program is the importance of the group, how we come together, and it's something magic about a group, and that creates a situation that when you don't even want to come to the gym, you have to come to the gym, you're still calm.
I could honestly say, as some of the aunties and there's a couple of the guys here that, there's a fair possibility if they hadn't started this program 4 years ago that they wouldn't be here with us today.
Will you go forwards?
We can only achieve the outcomes we achieve by delivering on the promise of responding to community needs. So you're not going to get any outcomes if you can't expand services, if you can't increase people's access to those services, but also that you've got to empower the individuals to take control of their health. And that's the fundamental thing, that you must use community culture and have really strong institutions of governance to be able to make sure that those outcomes are realised.
Good intentions aren't enough, and what's really struck me about this organisation is they follow up good intentions with hard work to understand the nature of the problem, to collect data on the extent to which their solutions are actually working, and the results are very impressive.
One of the markers of that is bringing youth along, bringing young people along. And all these organisations have a commitment to leadership and to developing leadership moreover, to getting young ones into the business, getting them skilled up, building their capacity to take over, because someone's got to take over.
The traineeship meant a lot. It's helped me figure out what I want to do next year. So last year, not many of us knew what we wanted to do. Now I want to become an exercise physiologist. I want to go study at uni next year. So this working with the allied health professionals really opened our minds up and opened our eyes up. It's good.
Indigenous health has become exciting, and I know that sounds, a little bit of an oxymoron, but it really has. made the myth about going to your doctor and, you know, so our mob aren't scared anymore to go along and get a health check and, you know, but to sit there and talk to the doctor and let them know honestly what problems they have going on.
I think really strong feedback we've received over the last 5 years. I think our best stats that we use, we talk about people voting with their feet, and we look at that being the measure of community control now, not necessarily how your board's governed or how many people turn up at your elections. Most important now about how many Aboriginal people are exercising control over their decisions in terms of accessing health care or making healthy lifestyle choices. And that's all the evidence we need to know that we're hitting the mark, that people are responding, voting with their feet and taking control of their health.